In Sri Lanka, there are 1 in 4 people suffer from some type of mental illness or trauma revealed as a result of a study done by the World Health Organization. And on the other hand, only 20% are receiving treatments. So again, Sri Lanka has recorded one of the world's highest suicide rates in the world, and stigma attached to mental health in Sri Lanka is really high, while the mental health literacy is really low. So there are 67 psychiatrists in Sri Lanka plus 19 psychologists, registered psychologists.
Actually, it's very difficult for patients to be able to access therapeutic modalities and or any form of kind of creative therapy or anything like that. So actually, for the majority of the patients, even in services and on the wards, their treatment is going to be medication. So although ideally some of them might receive particular therapies or structured therapies, the reality is that it's quite unlikely they're going to receive it.
I don't think none of Sri Lankan service users come directly to the doctor. Most of them will go to the clergy of their own temple or belief. Then they will check their horoscope, and then they will do some rituals at their holy places, and if nothing works, they will come to the doctor. So the Sri Lankan psychiatrists are in the sort of limelight because Sri Lankan government only recognize psychiatric treatment. So there is very low level of psychological interventions in this country. For an example, if somebody is suffering from schizophrenia, he might tell that he can see different things and believe different things and do various odd things, and people will believe that he has got some special powers also. So that belief will not sort of influence him to go and seek treatment.
Mental health or the psychiatric facilities and the modalities in Sri Lanka need to be more developed and also need to spread island-wide. And the rehabilitation activities also need to be improved more and go to the people who are living in the ground level as well, and especially the mental health community-based projects and the programs also need to address the issues of common people and need to go to the ground level.
I've worked in UK and Australia, and I've seen a lot of the psychiatrists and psychologists who are trained in those countries bring their skills to the local setup. But one of the issues that we see is that the health ministry and some of the organizations aren't able to provide us that level of care because of the lack of resources.
Even the current situation is more challenging, but it's really appreciative how the 67 psychiatrists who are available in the country are working forward for the well-being and the development of the mental health care in Sri Lanka, coping with the 1% of mental health, 1% of health budget which goes to mental health. So it's really appreciative how they are working towards the well-being and towards the development of mental health care of Sri Lanka.